Good morning, ladies and gentlemen. Today I would like to discuss the secondary causes of hypertension. As you know, 95% of cases of hypertension is due to essential hypertension, in which we don't know an exact cause. But in 5% of cases, it is secondary hypertension. You should think of causes like sleep apnea, drug-induced or drug-related hypertension, primary aldosteronism, chronic kidney disease, renovascular disease, and long-term corticosteroid therapy or Cushing syndrome, pheochromocytoma, coarctation of aorta, thyroid disease, and parathyroid disease. And let me explain each one by one. First of all, the most important thing we need to think about is genetic causes. Many times just genetics play a wide role in causing secondary hypertension. And most of the times it is just mutations in single genes related to Mendelian inheritance. Now, one of the questions you commonly come across is on Liddle syndrome. There are four things in Liddle syndrome: early onset hypertension, hypokalemic alkalosis, low renin, and low aldosterone levels. Again, there are four things in Liddle syndrome: early onset hypertension, then hypokalemic alkalosis, low renin, and low aldosterone levels. So that is basically Liddle syndrome, and most often you might come across a question like that. And the second most important thing you need to remember is renal disease. Renal disease, especially renal parenchymal disease, is the most common cause of secondary hypertension. That's very, very important to remember. Renal parenchymal disease is the most common cause of secondary hypertension. Now, renal vascular hypertension, it amounts to like 1 to 2% of hypertensions. Most of these patients will have renal artery stenosis. In younger individuals, renal artery stenosis happens due to fibromuscular hyperplasia. Now, coming to how do you suspect renal artery stenosis? You can do a CT scan or MR angiography. In 2006, there was a public health advisory against using gadolinium because it might precipitate nephrogenic systemic fibrosis in patients with advanced renal failure. So when you start ACE inhibitors, you need to make sure that the patient does not have bilateral renal artery stenosis, because when the patient has bilateral renal artery stenosis, ACE inhibitors, they make the condition more worse. Now, primary hyperaldosteronism. It occurs because of excessive secretion of aldosterone by adrenal cortex. And there will be excessive secretion of potassium, there will be water retention, and ultimately that leads to hypertension. Now, Cushing syndrome. In 75 to 85% of patients with Cushing syndrome, they develop hypertension. It may be related to salt and water retention from the mineralocorticoid effects of excess glucocorticoid. So in Cushing syndrome, even though the exact mechanism is not known, most often it is ascribed to this water excess due to mineralocorticoid activity of glucocorticoids. Now, pheochromocytoma is actually found in less than 0.1% of people. And as you know, hypertensive crisis might occur in pheochromocytoma. That's why it's important to treat them with an alpha blocker and then a beta blocker. And hypertensive crisis might be started by a variety of drugs, including tricyclic antidepressants, metoclopramide, naloxone, and anti-dopaminergic agents. So these drugs should be used with caution in patients with pheochromocytoma. Then coarctation of the aorta. It puts a lot of burden on the heart, and eventually causes secondary hypertension. Now, hypertension in pregnancy. Pregnant patients developing hypertension might eventually go into preeclampsia and eclampsia. Now, estrogen use. Estrogen use, especially in young women taking oral contraceptives, may cause increased blood pressure. So, it is a good thing to warn them when you prescribe oral contraceptives, and especially in women older than 35 years, women who are obese, and women who are taking contraceptives for more than 5 years. It is very important. But postmenopausal estrogen use is not associated with hypertension. In fact, it causes renal artery, vasodilation. In fact, endothelium mediated vasodilation that occurs throughout the body, it helps hypertension when you use estrogen postmenopausally. But in oral contraceptives, that estrogen, premenopausally, it has the risk of hypertension. But it is reversible. Within a few weeks after you stop oral contraceptives, the hypertension, it goes away. And finally, the medications. There are so many medications. In fact, all NSAIDs, tacrolimus, cyclosporin, they all worsen the hypertension. So basically, those are the important causes you need to remember as the main causes of secondary hypertension: sleep apnea, drug-induced or drug-related hypertension, chronic kidney disease, renovascular disease, primary aldosteronism, Cushing syndrome, long-term corticosteroid therapy, pheochromocytoma, coarctation of aorta, thyroid disease and parathyroid disease. And please post your comments, and if you have any important good points, please post those comments in our blog, and visit all our blogs with hundreds of videos as you prepare for USMLE at usmlevideos.net. That is www.usmlevideos.net. Hundreds of videos. You can learn a lot of things, and you can read comments, and you can put your own comments describing most important points you found useful, so others could learn and prepare well for USMLE. Thank you. Have a nice weekend.